Hello everyone, it's Greg Hemstreet. It's after been 2 months since my surgery, so I thought I'd give you an update. And it's a absolutely beautiful day here in Texas, so I thought I'd take a few shots from my outside porch to brighten up everybody's day. So it's been now just over 2 months since I had my surgery, and I just wanted to give an update, let you know how things are going. Really nothing serious to report. Continued recovery. I've stopped taking major pain medications. Just occasionally when there's an ache or something like that. I'm exercising pretty regularly, trying to get between 3 and 4 miles in a day, and I'm continuing to lose weight. So actually things are going really well. I'm able to drive longer distances and tolerate getting in and out of the car a lot better. I guess that's probably been one of the hardest things to adjust to after the surgery, was just getting in and out of a car. But otherwise, things are going really well, and I'm looking forward to being able to get back to a more regular exercise routine, in addition to a better quality of life. Before the surgery, I couldn't walk more than a block or two without being in pretty serious pain. Now I'm easily able to walk the whole neighborhood. At first I started with out walking the dogs because I didn't want the dogs to pull on the leash and twist, but that's no longer an issue, and so I'm walking the dogs. I only take one at a time so that I can control them better, but otherwise I'm actually kind of enjoying that too. So overall, I think that it's actually gone really well. I think I mentioned in my last post that I wish that the doctor had actually prescribed some physical therapy, because I feel like there are some stretching exercises and so on that would actually help me. So if you have the surgery, I would recommend that you talk to your doctor about making sure that physio is set up as a prescription for your recovery afterwards. Maybe not the first month, but certainly the second month should be no problem going to physiotherapy and actually getting a little bit of proper training from that standpoint. So, just to recap, I had the surgery on December 13th. It's now past February 13th, a couple of months later, and I'm back to basically a regular routine. I still have some pain sometimes in my hip, which is the reason I started going to look into having the surgery in the first place. And that's a little bit concerning, but they said in the post-op instructions that those nerve pains would probably exist for some period of time into the future. So I suspect that it's no big deal. I'm going to report again in the middle of March, and I have a doctor's appointment the second week of March as my 3-month checkup. I'll have x-rays taken again then, and I'll include them in my next post so you can see what the x-rays look like sort of as we progress through the recovery. I would recommend having this surgery to anybody who's got serious lower back problems. It's been pretty good in terms of being able to recover. I was really worried about being out of action for a long period of time. For sure you're going to want to have 2-3 weeks off work, but other than that, I think it's definitely a great opportunity to get back to having a very active lifestyle. The other thing that I think is important is for you to track your drug usage and make sure that you're not becoming dependent on the pain medications to get about your regular life. Like I said, I've sort of weaned myself off, and at this point I've got a few pills left just in case there's sort of a relapse or something like that. But yeah, I'm still not lifting very much. They say don't lift more than a jug of milk, which my daughter tells me is about 8 pounds. I might be lifting 10 pounds worth of groceries, but not much more. And other than that, I'm really not doing too much in terms of lifting. I did have one incident where a package was delivered and I thought it was lighter than it was, and so I lifted that. And I ached for a couple of days afterwards, but nothing more than a few aches, and that seems to have gone away entirely, so it's not really a problem. Anyway, that's kind of an update on what's going on, and for sure, things are actually going pretty good. Anyway, I'll talk to you again in March.